Hey, we want to welcome you to our show. It's a new show, actually. It's the same show, sort of, but it's new. It was formerly known Get Covered Ohio, where we mainly dealt with healthcare, the healthcare issues, open enrollment, the Obamacare, which is actually called the Affordable Care Act. We had guests on talking about where to get enrolled, how to get enrolled, whether it was marketplace insurance or Medicaid. Well, we've changed our name. Now we're called Your Health and Faith Community. Yeah, we're going to still talk about health care, but this gives us an opportunity to explore other things in the community. Gives us a chance to talk about what's going on, whether it's the drug epidemic with the heroin, the overdoses. I believe maybe about a month ago on a Wednesday, we had maybe 60 or 70 people overdose on one day, and I think there were 4 deaths. So that's something that we definitely need to talk about because it's a very serious issue. But it also gives us a chance to talk about faith. And the way I see it, faith and health go together, because if you're faithful and you're healthy, what a great day can it be, right? So again, our new show is called Your Faith and Health Community. So we're going to jump into it like we always do. I'm your host, Pastor Jackie Jackson, and we have 2 great guests with us today. One we have sitting to my left is Valerie Dow, and Valerie and I have been working together for a while, and my mind doesn't work that well, so I'm going to go here and make sure I read everything right. So Valerie Dow has a BA in Health and Human Services. She's a certified community health worker. She also works where we work together with the Cincinnati Human Relations Commission as a community outreach advocate. And you've probably seen her face or seen us somewhere, especially if it turns out to be a shooting or a homicide, which is a really bad thing. But it gives us a chance to communicate with the community and to try to help people kind of transition through this period. She's also, which I find very exciting, is that she sits on the board, the advisory, the Consumer Advisory Board co-chair of the National Healthcare for the Homeless, which I find very interesting. And we also have as our guest, and again, this is our first guest for the new show. This is really awesome, right? We have Britton Carter, who is a CDCA as well as a CPS, which we'll let him explain what all those initials mean, and an addiction therapist at UMADOC. And we work together as well with the Cincinnati Human Relations Commission as a community outreach advocate. Britton also is a playwright, an actor, and he fashions himself as a singer as well. So we're going to jump right into this show. And we're going to start off with Valerie. How are you doing today?
I'm fine.
Great. Mm-hmm. So tell us a little bit about this long list of things that you do within a 24-hour period.
One of the things I do, and one of the things I believe in, is making sure anyone that I come in contact with, their basic needs are met. And basic needs can mean shelter, food, housing, health care. Cincinnati is very fortunate to have, to really be resource rich. And what I mean by that is that you could take a homeless individual, they have a one-stop health care system here where they could go for medical, behavioral, and dental services without medical insurance or without the ability to pay. And then...
well, I'll tell you what, before you move to the next thing, talk about that a little bit more. This service, you said without health care, without income, that they could still get these services. So tell us a little bit more.
So up under the health care for the homeless, any one that receive funding through the federal government, when they're homeless, their services is really paid for by the federal government. And so if I was to go there for services, being homeless, they have a open enrollment person.
Going where? If I go where?
Going to McMicken Healthcare Integrated Care Center. It's located at 40 East McMicken. Anyone that is homeless, you're not turned away without the ability to pay.
Okay, so you said that's on
McMicken.
McMicken. On McMicken. Okay, mm-hmm. So anyone that is homeless, no income, they can go. What type of treatments or what type of services are available for them there? From a healthcare standpoint.
Okay. They have medical services. They have excellent doctors from University Hospital, Christ. Some of them are from private agencies, and they have mental health services from Greater Cincinnati Behavioral Health. And then they have a dental program as well.
Okay. So is this by appointment, or is it a walk-in? You can just walk in and get help? You need an appointment? You need a referral from Job and Family, or?
It's not a referral system base. It's a walk-in. They have walk-in hours from 7:30 to 8:30. Outside of that, you would have to call and make an appointment.
Okay, so that's good. I didn't want to move past that without talking about it, because we never know who's listening or who may need someone to actually direct them there. So now continue. You were going for probably made you lose your place.
Yes, it did. So, and then, of course, what I do for CHRC, Cincinnati Human Relations, I do outreach Monday through Friday. Well, no, I'm on call 24/7. So, we respond to a lot of shootings and homicides throughout the city of Cincinnati. But we also engage people in trying to help them find another way out of the lifestyle, whether it's drugs, alcohol, or criminal activities. So we kind of provide just their basic needs services, and connect them with other agencies for housing and employment.
Okay, great. Let me jump over to Britt for a minute and give you a chance to, since I threw you off.
Yes, you did.
I tell you what, why don't we start out, Britton, with you explaining all of these initiatives that you have behind your name.
Okay, absolutely. Well, actually, I'm a CDCA, and CDCA is a chemical dependency counselor assistant, and I'm also a CPS. I have a CPS certification, and that stands for Certified Peer Support Specialist. Both go hand in hand. I'm a therapist working at HUMADOT, and HUMADOT stands for the Urban Minority Alcoholism and Drug Abuse Outreach Program. And it was founded by William Mallory. I'm sure you've heard this before. In 1980, William Mallory and Bill Bourne got together, and they had this great idea to structure a drug and rehab facilities where we can service our communities. And meaning our communities, I mean the urban communities, the black community, the Latin community. And so we span throughout Ohio. Actually, there's 12 HUMADOTs across the state of Ohio. They stem from Cincinnati all the way as far as Youngstown, Ohio. We have one sector that specializes, and they specialize in the Latino community, and that's up near the Youngstown area, I believe, Youngstown, Toledo area. Okay, and so we basically, what we do, we provide drug rehabilitation assistance for our clients. We also have a preventive piece as well as the addiction to recovery piece, and we try to extend our programs. We have like 10 to 12 programs in our particular agency, and they stem from everything from helping children and children's development. And what I mean by that is if we have troubled teens in school, we try to get ahead of the game, and we try to work with them early and get early prevention in, and just try to steer them along the right way. So we're basically a drug and alcohol facility that has many tentacles.
Okay, great. So I'm going to put this question out for both of you guys. We know with the epidemic going right now with the heroin in the streets, and I'm curious to know, even from a homeless standpoint, and then you're dealing with, I'm assuming that you're touching some of the people in this area. Do you see, or do you think there's a big issue in the homeless community with the heroin? Is that touching that community at all?
I think with the drug epidemic, what I see an individual who is bright, who is educated, and they're on drugs. And homeless is beginning to change. Homeless used to be the chronic alcoholic, and then it went to the people who smoke crack. Now it's going to the individuals who's shooting drugs. And I don't know, it's a lot. It's a lot to even wrap your mind around, coming from living in a middle-class family to becoming homeless. And it's almost the norm now. It's just, when I look at it, that's what I see. It's acceptable.
Being homeless?
Being homeless.
Okay.
Mm-hmm.
So in essence, yeah, you are seeing
Yeah.
because and speaking specifically around heroin, that you
Yes.
are seeing that the heroin epidemic is affecting now
Yeah.
you're seeing it affecting the homeless community.
Yes.
All right, and then if we switch over, and I don't want to say switching over to your side as if they're sides, but you're working directly in the treatment. So are you seeing, through UMADOT, seeing a lot of the people affected by this epidemic?
Yeah, from the HumaDOT perspective and from our lens, we see it similar but somewhat differently. First of all, I think that it should be noted that the homeless community has always been affected by the drug epidemic in this country. Actually, it was pervasive in that community. It was more so seen, the lens was brighter on the homeless community, and not until recent years did it start to escalate into other communities. And that's when we began to put titles on it such as epidemic. When it arrived in the other community, it became an epidemic. Mm-hmm. When it was basically in the homeless and in the urban communities, it was a drug problem. It was an issue. Mm-hmm. So, but we see a great deal of it in our homeless communities. When you're talking about drugs and being addicted, becoming homeless, become downtrodden.
It doesn't have a color to it.
No,
It doesn't have it absolutely doesn't have a color to it. And I was just asked a question a couple of days ago, and it was in reference to identifying the addict. And you can't identify the addict. You can't go out and say the addict is a 9-to-5er or the addict is the guy that's standing on the street corner. It just doesn't have a face with it today. Today, the addict can be on Capitol Hill.
That's right.
Today, the addict can be a white housewife that lives in Georgetown. So it runs the gambit. And particularly when we talk about this heroin epidemic, heroin has always been alive and thriving, particularly in the black community. As you know, at one time, and I don't want to get political. Actually,
that was a
absolutely.
crazy.
Yeah.
Absolutely. It was dropped in our communities, and I don't like to have these conspiracy theories, but it landed in the downtrodden communities. It was a drug that was specifically targeted towards the black communities and the grassroots users, hippies, musicians, so people that were seen not in the high class echelon, but people that were just downtrodden, and that's usually us, So basically, the focus was on the black community, and that's who you saw using heroin at that time. Heroin today is so cheap. Is so cheap, and mainly because there's so many additives that's put in the heroin today. The heroin today isn't actually the heroin that they had yesterday. The heroin today is carfentanil. The heroin today is fentanyl. Yeah. You have all these other additives. You have all these other chemicals.
Not saying that the heroin from say the 70s or 80s was a good thing to have.
No, definitely not saying that.
Actually, now it's worse.
And when you look at the fatalities, when you look at the harm that is causing in our community, the devastation, the lives that are being taken, come on, you have people driving down I-75 who are nodding out behind carfentanil and fentanyl and killing themselves the passengers in the car. So when we look at it, you know, and we say the heroin of the 70s versus what they're calling heroin today,
Right.
you
It's
know what I'm
totally
saying?
different.
Then it's totally different. And yeah, for the lack of a better word, it was better. No drug, nothing that can control your life to that magnitude is good for you. You know, I know firsthand. You know, nothing of that magnitude is good for you. It can't be healthy. You know, you lose dreams, you lose hopes, you lose desires, you lose family. It's a lose-lose situation. Whether you use in the 70s, and we still have some of those earlier addicts from the 70s that are using today, and they're dying at alarming rates because they're shooting drugs today with the mindset that this is the same drug that I was shooting
Back in the
10, 15
70s.
years ago, and they're dying.
And they're dying. You know I was coming home, it was about a month ago, and I called Pastor Mingo about it. I was going home about 1:30, 2 o'clock in the morning. I was coming up 75 just past Hopple, and I saw a car sitting on the medium in between north and southbound, and the car was sitting up on the medium at this angle.
Right.
I pulled over, so, you know, I was driving, so I had to pull over. By the time I got back, I saw the car shoot across the expressway and ram into the wall on the right side, the slower lane, I guess what we're going to call it. And I
Right.
got out, obviously I went back up and we talked to them. And it turned out that they were shooting heroin and both had nodded out. And
Right.
only by the grace of God was no one other than them. They were hurt, they were taken away. But no other cars were involved in that accident. So it is definitely a problem. And the good thing is that it's getting attention. The bad thing is that it was such a problem in the urban community for so long.
Right.
And like you said, then it wasn't an epidemic, then it wasn't a sickness, then
Right.
it was just whatever it was labeled. So, but now that it's moved into, and it is in communities, it is in over the Rhine, but it's also in Mariemont, it is also in Indian Hill, it is also,
Right.
it's all over the place, and so now it's getting attention. I want to talk about, so we know what the problem is,
Right.
right? So there's no
Right.
secret. Nobody's scratching their head going, gee, what's the problem? We know what
Right.
it is.
Absolutely.
But since you two, you know, working with homeless and still dealing with individuals that are drugs, I know you have some certification dealing with dependency as well, yours. So what are some of the solutions, or what are some of the things that we can look at moving forward to help, and especially for people that are watching that may know, I don't think there's any, well, let me change that. I'm sure there's somebody in the city, but it's probably hard to find 50 people in one room that does not know someone who has been touched by or is currently dealing with an addiction, or some family that's dealing with it. So what do we have? What can we say to people like, okay, we know there's a problem, here's some solutions, and you guys work in that field. So let's talk about what do people need to do?
You know, I like to talk about the healthcare risks
Let's talk
of
about
using
that.
the drugs, because nobody is talking about it. They're not talking about, or they may not even know, what is the risk, or how do you detox a person?
What is the risk? What is the
Some
risk?
of the risks, well, some of the risks with using any drugs, that's alcohol, crack cocaine, and heroin from the 70s. Some of those risks is hepatitis C. Some of those risks is STDs. Some of those risks are HIV. We got to start talking about the risks of using the drug, you know, until they come up with a solution. They still haven't found a solution, because who been shooting fentanyl? How do you detox a person who has shot fentanyl?
When you say haven't come up with a solution,
Gotta come up-
well, I guess what I'm asking for people that are watching, that they're not in the field, they're not in the health field, or they're not in the drug treatment field. But let's just say I'm noticing my son, or someone's noticing their husband or their wife. I tell you what, let's work it this way. Let's go with some signs that people may be able to look at to get an idea. Okay, not looking at economic status, but just
Okay.
looking at and saying, okay, I've noticed this pattern in my son or my daughter, husband or
Right.
wife or whatever, and to be able to say, it seems like maybe this is something they're dealing with. Is there anything
Well,
that we can
if
do?
I can, if I could briefly touch on both questions,
Okay.
because I think they go hand in hand. When you talk about awareness, you have to also talk about what's available, and in order to derive at a solution. And one of the things that I find to be prevalent today is that we have to make available. We have to make available treatment facilities. We have to make this treatment available. We put too much emphasis on dollars and cents to provide treatment. That's one of the things that stops an addict from seeking treatment. So, and part of the solution, we have to come up with means of treating the addict without a cost. Thank God Obama came up with and I'm quite sure those that was previously against Obamacare, if your son, if your daughter, if you live in Indian Hill and they happen to be suffering from addiction and they come to our agency, they can get in based on their insurance and Obamacare. As a matter of fact, with our agency, you can come, and if you don't have insurance, we're going to find a way, because the city has been so gracious and allotting funds for treatment. And we happen to be the recipients of some of those funds at one particular time. So when we start talking about some of the signs, now we're looking at the signs. And my son comes in, and I'm used to him acting in a certain way. For instance, with school, some of the basic signs are if he's staying out later than usual, if he's not being responsible, if he's not cleaning himself or herself, if they're running with a different group of people, if they start to just neglect all the things that hygienic things. When we talk about hygiene, it's just more than just the obvious, soap and water. When they're letting their hair grow out long, and they get a little tinge about them. We start noticing these things. Something's wrong. Something's wrong. That's when you need to sit them down and talk with them, and you should call a professional. You can call our agencies. You can call the addiction counsel services, and we'll get them in and evaluate them and assess them, and and get them the treatment that they deserve. But when you have, and even not just only with children, but you have some of the same things in adults. Adults that are not getting up and going to work, losing jobs, reacting and responding to people aggressively, and just changing it's about unmanageability. When they become unmanageable, when their lives become unmanageable. So these are some of the signs that we look for, and we know at that point that there's something that needs to be addressed. And oftentimes it's a dual addressing that we have to do. We don't even only have to address the substance abuse part, but there's a mental health piece that we need to address. Because along with that, oftentimes you incur mental health issues. PTSD. Most of us don't associate PTSD with drug addiction. But if you're in the streets and you're hustling in the streets, it's a violent world out there. It's violent. You have to acquire some parts of PST to, it's there. It's prevalent. So,
Absolutely.
yeah. So, these are some of the things that we look at coming in when we do an assessment, to see how we can best serve the client, because that's who we work for. Even with us at CHRC, we work for the public. We work for our client. Our client are our community, and we want to provide the best treatment possible. So we look at all aspects of their life.
And I want to jump on that because I know, Valerie, that you have some certifications dealing with mental health as well. Right?
Well, I have.
I know you have a list that we didn't even put on here. But,
So, and with the certified community health worker, we're talking about looking at a person from a holistic point of view.
Absolutely.
So let's talk about, when I work with a client, I don't just go to stop at the basic needs. I don't just ask, do you have clothing, shoes, apartment, and all of that. Because if we, in working with people, and once you study the environment and where they grew up at, now we're talking about trauma. You know, it goes right in hand with the PTSD. A lot of people who we work with are traumatized based on the series of events that has happened in their life. Even with the homeless population, many of those are diagnosed with PTSD. It's a job to be homeless. It's a job to live on the streets with one eye open and one eye closed. You know, it's a lot, you know.
You think that's probably what may be pushing some of the homeless population toward Heron, to deal with that day, to deal with the day-to-day process that they're going through?
I don't know.
I know that's a hard question.
You know,
but it was a
you know, it was a good punch. But you know what I see, and through talking with some of the homeless people, they had a life before.
Right.
They had a life before the drugs, and a lot of them put it on. I got addicted to the pain pills, and the pain pills got me addicted to this.
Right.
You know.
It's gateway.
It's gateways to everything.
Exactly.
Another pipeline. That's what I look at.
Exactly. And you know, I think that, you know, in all fairness, you know, drug addiction is an equal opportunity employer. And when we talk about being equal, we've got to give as much credit for the destruction of the human being, not only to heroin, but to all drugs. You know, so when we talk about drug addiction, we're talking about heroin, we're talking about crack, we're talking about alcoholism. You know, wet or dry, is a drug is a drug. And anything...
Even prescription drugs.
Absolutely, which is...
Might
I mean, come on. Hey, the most profitable drug deal out there is pharmaceutical companies. And, you know, I mean, so, yeah, a drug is a drug. So, you know, I give just as much credit to each and every one, because a homeless person doesn't pick and choose which drug he's... See, this is a feelings disease. And it's about changing how we feel. You know, so when they're using drugs, when the addict is using drugs, he's 9 times out of 10, 10 times out of 10, he's trying to medicate something. Right. He's trying to change how he feels about a particular issue. So
whether it's a present issue
or past.
Sometimes burying something or to keep something buried from the past.
And when you do the research, you know, when I hold classes, I usually try to do a timeline. And in doing a timeline, you know, we research back to our early years, our first brush with trauma. Where did that trauma come in at? Where did that disruption and that normal process take place? Because usually when you find where that disruption took place, where that trauma took place, there's where the door was busted wide open. Because, see, the disease of addiction is oftentimes just lying dormant, just waiting to hitchhike a ride on something. Now, the ride can be alcohol, the ride can be heroin, the ride could be cocaine, the ride could be candy bars.
It's just looking
Sex,
for a ride.
food.
It's just looking for a ride. It's out hitchhiking looking for a ride.
Yeah.
So as soon as it catches this ride, it's on it, and that's what it works with.
Well, look, I wish we had more time, but we know you two are going to be our guest on our next segment. And so we're going to continue this conversation because there's a lot that we didn't touch in the Bible that says, in all you're getting, get understanding. So we want to make sure that we're able to get understanding of what's going on with our community, wherever your community is, no matter if it's on the west side, east side, north, south, and in between, and how we can help our community. Again, I'm Pastor Jackie Jackson with Your Faith and Help Community, and we look forward to seeing you again. Hope you have a great day.